Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
The XLIF procedure stands for Extreme Lateral Interbody Fusion. It's a corridor to get to the spine going straight through the side. And the benefit is that you avoid the back muscles. You also are able to stay away from the abdominal contents. So it's a way to get through the side in a fascial plane to get to the spine and do the work on the interbody space. Well, typically anyone that has a problem above where the rim of the pelvis is, say L4-5 or above. Now sometimes the L4-5 disc space is difficult to get to because of where the pelvic rim is. But any patient who has the disc itself as being the pain generator, or someone who has spinal stenosis or foraminal stenosis due to collapse of the disc space and narrowing of the nerve channels, you can achieve something called indirect decompression by putting a spacer in and separating the vertebra. By doing that, you open up the nerve channels. Of course, any surgical procedure on the spine carries risk. There's always the usual risks with any spinal procedure of infection, damage to the nerves and paralysis, tears of the sac that holds the spinal fluid. But with the XLIF procedure, a lot of those risks are minimized. Now what I have seen is that particularly doing the L4-5 level, sometimes the nerve there is close to the retractor and it can get stretched, and I have seen cases where there would be dysesthesias or numbness and pins and needles type sensation in the thigh, and even some cases where there's weakness of the thigh muscle or the quadriceps muscle. But in virtually all the cases I've seen that resolves over the course of about 6 weeks. I see my patients at about 7 to 10 days. Typically they stay one night in the hospital, get up and walk the very next day. The bandage is typically left on until they come back to see me in a week. The incisions are very small, so it's very small bandages, usually minimal drainage from the wounds or the incisions. The next follow-up visit is at about 6 weeks post-op. At that point I get x-rays to look at the position of the spacer. And then typically after that it's a 3-month follow-up, then a 6-month follow-up, and then a follow-up at about a year. And if everything's going well, I just tell patients, call me if you need me. But if there's still some issues, then I see them as long as is necessary. I tell patients that as far as what they can expect to do after this procedure, what their activity level can be, is really largely dependent on them and what they do in the post-op period as far as after healing of the graft, working on abdominal strengthening or core strengthening. So if the bone graft heals completely and the patient does a good job of strengthening their core, there really are no limitations. They're able to get back to whatever it was they were doing. It's really, in almost 25 years now that I've been doing spine surgery, is one of the technologies that I would have to say has really revolutionized what we do, and it's been very beneficial to patients from the standpoint that it does allow a very quick recovery, and it's really given patients a much better quality of life.
For more information, visit us online at conwaymedicalcenter.com.